Hi, I'm Dr. Colin McLeod, ND, and in this video we're going to talk about contaminant metals with a focus on lead. We'll touch on what contaminant metals are, where lead comes from, how it gets stuck in our bodies, how it affects our health, and how we get rid of it. While many metals such as calcium, magnesium, and zinc are naturally used by our bodies, we don't use all of the metals that we take in. Some metals actually can clog up and disrupt our normal biological pathways. Lead, for example, is very similar in structure to calcium. It's so similar that it's actually carried by our own calcium transporters throughout our body. And while calcium has important functions like ensuring bone strength, muscle contraction, and nerve signaling, lead only acts to disrupt these functions and other aspects of metabolism. In the 20th century, there was a large increase in exposure to lead due to the addition of lead to gasoline and paint. While gas and paint are no longer leaded, this additional lead is still present in our environment to some degree, including in the food we eat and the water we drink. Water pipes still are significant sources of lead exposure in some older homes and older water systems. Some other sources of lead exposure could be wheel weights, ammunition, acid lead batteries, toys, cosmetics, electronics, tobacco smoke, and industrial emissions and incinerators. Lead is absorbed 100% through the lungs and 50% through the digestive tract. Once it enters the bloodstream, it is carried by the red blood cells and ends up replacing calcium atoms throughout the body, but primarily in bone. The half-life of lead in the body is 5 to 30 years, depending on if it settles in trabecular or cortical bone. In adults, an elevated lead level is associated with stickier blood, artery stiffening, increased inflammatory mediators in the blood, and high blood pressure. At even higher levels of lead exposure, memory loss, poor concentration, and anemia can occur. High levels of lead are associated with plaque buildup in the arteries, as well as a higher risk of stroke, heart failure, heart attack, and peripheral vascular disease. On top of this, people with lower levels of lead tend to live longer than people with higher levels of lead. All this data is taken from a collection of 10 studies with 110,000 participants from the general population. This data was also published in a position paper by the American Heart Association in June of 2023. Lead causes even more severe effects in children than it does in adults, including cognitive delays and lowering of IQ. For this reason, we're going to focus on adults in this video. We're going to leave the discussion of the effects of lead on children in another video. Lead naturally leaves the body on its own, but it does it slowly. For example, it would take 90 years for 90% of the lead in a person's body to be excreted mainly through the urine. This means that not all the lead in a person's body will leave during their lifetime, especially when we consider that we're continuously exposed to at least low levels of lead from our environment on a daily basis. Because lead binds so tightly in the body, and because of its negative health effects, it's important to reduce our exposure wherever possible. While lead is naturally excreted very slowly, modern medicine does have a solution to safely remove lead over the course of months rather than decades, and it's called chelation. We'll talk about chelation more another time, or you can check out the article linked in the description of this video to learn more. Thanks for watching.